Okay. All right, Mayor Anderson, you are live on YouTube.
Okay, I'm going to call the meeting of the Lafayette City Council to order, October 13th, 2020. Let the record reflect that all council members are present via Zoom or telephone. And with that, we'll go to adoption of the agenda. Are there any changes to our agenda for closed session? Can I get a motion?
I move we adopt the agenda.
No second?
A second.
Moved in second. Call the question. Councilmember Bliss?
Aye.
Councilmember Burks?
Aye.
Vice Mayor Kandel?
Aye.
Councilmember Geringer?
Aye.
And I'm a yes, so we'll move ahead on the agenda. That brings us to public comments on the items on the closed session agenda. This is an opportunity for the public to speak on an item that is on our closed session agenda. And do we have anyone wishing to speak under public comment?
Yes, we
Yes.
do. We have one hand up, but I'll just remind folks that if they do want to speak and provide public comment, to please use the raise your hand function, or if you're on a telephone, *9. With that, we have Brian Winter. He has his hand up and he'll be joining the meeting now.
Okay.
I have the timer, Mayor.
Okay, thank you.
Thanks, Joy.
Good evening, Mayor Anderson and members of the City Council. This is Brian Winter from Miller Star Regalia on behalf of O'Brien Land Company. I regret to be here before you again tonight addressing an issue that we have addressed many, many times before. But at this point, post approval of the terraces of Lafayette on a 4-1 vote by this council in August, in the eyes of the law, the city's interests are aligned with those of my client in defending the land use approvals this project obtained and ensuring that it is successful. We're here, of course, because of the bias of Vice Mayor Susan Kandel, based upon an array of facts that we have detailed in the record many, many times. The legal standard here, of course, requiring recusal in a situation like this is an unacceptable probability of actual bias that is considered to be a low legal standard. Here, not only have we demonstrated over and over and over again an unacceptable probability of bias, but we have also demonstrated actual bias. And I think that actual bias was also demonstrated through your hearings in August. A little more than a year ago, the Vice Mayor voluntarily disclosed advice that she had received from Mr. Hodel about her bias to the Fair Political Practices Commission when she was trying to seek her own private advice. And she also admitted, in fact, that she has a bias. The situation we're dealing with, as I hope is very apparent to all of you, hampers the ability of your attorneys representing the city in this litigation, again, in which you have aligned interests with my client and in which my client has a due process right that warrants affirmative protection by the city, especially when the city attorney has reached legal conclusions that are consistent with ours about a biased council member who does not have an open mind and has been working against the project. I will briefly tell you my own experience as a city attorney dealing with conflict issues many, many times. Everybody in every instance followed my advice on conflict questions, except actually in a few instances when I reached the conclusion there wasn't a bias warranting recusal. And I had several situations where I was asked, oh, Brian, you're telling me there's not a conflict, and I understand that there's an illegal conflict, but could somebody possibly believe I might have an improper interest or motive here? And if you don't need me there to make a quorum, if you don't need me there to take a vote, I'm going to recuse even though you're telling me I don't have a bias. Never did anybody spend $7,000 of their own money trying to seek advice contrary to mine, and never did anybody argue with me about a conclusion that I reached or dig in their heels in any fashion. This is absolutely extraordinary on every level. I don't know what else to say about that. I don't envy your position here. There are a number of options available to you if the vice mayor doesn't follow her oath of office and recuse in connection with the ongoing processing of this project and the closed sessions you're about to have. But again, thank you for your time. I'm happy to answer any questions.
Are there any questions for the speaker? Okay, thank you very much.
Thank you.
Are there any other public comments?
Right now, I don't see any hands up. So if there is anyone that would like to contribute public comment, please use the raise your hand function now. Okay, and with that, Mayor Anderson, no more public comment at this time.
Okay, thank you very much. We'll move beyond public comment to the actual closed session. So we will go into closed session. We expect to come out by 7 o'clock for our normal open session meeting. So with that, we will adjourn to closed session.
Hey, Joanne.
Hey, how you doing, Jeff?
Good. Just wanted to make sure everything's up and running. And for people out there viewing, we are waiting for the council members to come out of closed session. We expect to start at 7 o'clock. And thank you all for joining us. We'll be back momentarily. Joanne, I'm going to make you co-host just in case something happens.
Okay.
All right, there we go. And we shall see everyone shortly. So stay tuned. Hi, Susan. We're just standing by here for the others. I do see that Supervisor Anderson has a question, so I'm going to move her in for a sec. Hi, Supervisor Anderson. How are you this evening?
Here I am. I just wanted to know if I would be able to share my screen as I'm speaking, just because I've got a PowerPoint that would make it a little bit easier to see what I'm talking about.
Absolutely. We once we move any of the speakers in as a panelist, when the agenda item comes up, you'll be able to share your screen.
Okay, terrific. Thank you
Okay.
so much.
Thank you for joining us again. I'm going to put you back in the attendees area, and then we'll move you over when the agenda item comes up.
Sounds like a great plan. Thank you so much.
Thank you. Okay. Joanne, we're getting a little background noise from you.
I'll shut.
Okay.
Got better?
Yeah, it sounds like a TV or something in the background, but you know, if you just remember to mute when you're not talking, that'd be great. Hello, Mayor Anderson. Welcome back.
Okay, howdy.
Hello, Stephen.
Hello.
There's your root. Was that the Zoom equivalent of playing footsies there that I saw?
Handsies.
Handsies, got it. Okay. I guess we're waiting for Cam.
He probably needs login information.
Yeah, he was in earlier. That's why I'm looking to see if I got an email from him, but I have not. I have not got a text. There he is. Okay. Okay, give me 1 second. Well, we're still 2 minutes early because I got to start the recording.
I heard you guys talking about me.
See?
I heard it.
You got to be careful what you say
I
because
know.
people can
I
hear.
know. I didn't have to send you another email, Jeff. I saved it.
I was looking. All right.
I think they knew you were there.
Okay, there's Mala. Okay, we got about 1 minute and then we'll get started.
Sounds good.
Okay, Mayor Anderson, you are live on YouTube.
Okay, thank you, Jeff. We are back in public session now, open session from our closed session, and we have no reportable action from our closed session. That takes us to item 7 on our agenda, which is public comments for items that are not on tonight's agenda. There's an opportunity to speak on a question or ask a question or make a comment on item not on the agenda, but within the purview of the city of Lafayette. Do we have any requests to speak under public comment?
While we're waiting, I'll just remind folks to use the raise your hand function if you do want to provide public comment, or if you have called in, you can use *9. And having said that, there are no hands raised at this time, Mayor Anderson. No public.
Okay. So with that, we'll move on to presentations, and we're very pleased to have our supervisor, Candace Anderson, here to speak to us about the COVID-19 update for the county. And there's Supervisor Anderson. Welcome. We can't hear you. You're muted, Candace.
I'm trying. The host
There
is
you
allowing
go.
me to unmute. And if it's okay with all of you, I am going to also share my screen and just sort of whip you through a PowerPoint of where we are right now in Contra Costa County. And so let's see if in fact we can get my slideshow going instead of my desktop. Okay. So here we are, as I've said from day one, head to coronavirus.cchealth.org or just Google CC Health to really see where we are. Every day about 11:30, we continue to update the website. To date, we're at just over 17,834 cases. Unfortunately, the majority of those have recovered. And it's always good to look by location. Lafayette, you're doing pretty well compared to a lot of the other communities in Contra Costa. Positive case count, you are a total of 143. but it still is active in your community. The last 2 weeks, you have had 8 new cases in Lafayette, and that comes out to, in total, from day one, you're at about 558.5 cases per 100,000 people. Now, compared to, for example, Alamo, that's at 800 plus cases per 100,000, you're doing pretty well. However, compared to even Moraga, they're down to 400. But you're in probably the lower third as far as the people of Lafayette are being careful and being cautious. But we want to encourage you to continue to be so, simply because the virus is still among you. So hospitalization data, to me, this is one of the most critical pieces that I've looked at every day since March, because we never want to be at the point where our hospitals are overwhelmed and we have people unnecessarily dying. And so many of you who may have logged in to our website or heard me speak during the summer months, we were at one point up to 110 people hospitalized with COVID. So the fact that we're down at 26 right now is really, really good. And 274 people in the Bay Area, compared to many parts of the country, that's really quite remarkable, and especially where we were. You can also go online to the state's website, and this shows you more ICU data for the entire state. And so right now it shows, again, our hospitalization at 38, and of those 38, 7 are in ICUs. And then it also shows us how many ICU beds are available in total, which is also important. This isn't COVID ICU beds, it's all ICU beds. There's really not a distinction. And of course, we have people with heart attacks, who have had strokes, who have other critical illnesses that occupy those beds. And we always want to make sure those are available. The nice thing about our hospitalization is not everyone ends up in the ICU, and we've come up with much better treatments as our doctors have figured out how to best treat COVID and avoid having everyone ending up on a ventilator. So still love to talk about who is getting sick. As you can see, the largest group of individuals getting sick is our 19 to 30-year-olds. And, maybe for whatever reason, they're out there getting sick. In many cases, they may be asymptomatic. In some cases, they may have mild symptoms, but that doesn't stop them from exposing those individuals who may be at greater risk, family members, parents, grandparents. And so even though these are young, healthy youth for the most part, it still is serious. Gender, interestingly, more women are getting COVID, or at least getting tested and identifying as positive than men. But when I get you down to the death statistics, you'll see that slightly more males are dying than women of COVID. Ethnicity and race of who is getting sick, and all of this information is on the county's dashboard. You can see that there is a disproportionate number of individuals who are Hispanic or Latino over other ethnicities. And we still have a data issue because we have a very large unknown number of individuals, meaning when their tests are taken, the collection agency, the healthcare provider, the lab doesn't capture that data. But we are certainly concerned, as you can see when we talk about some other metrics we now are working on, that there are certain segments of our population in Contra Costa County that are disproportionately showing up. Similarly, when you look at percent cases by race, though, outside of the Hispanic Hispanic Latino ethnicity, you'll see predominantly it is Caucasian, is the other large segment of the population. So who is dying? Again, fortunately, it's not disproportionately one specific race, but it by gender, as I mentioned, it's males and primarily Caucasians who are dying. Ages of death, and this is something that's a little morbid to watch, but it's something that initially it was mostly really old people who are dying. And we were seeing that, and a lot of people were saying, oh, they were going to die anyway. There is a morbidity. They were already ill. The majority of people who are dying, even if they had another health condition like diabetes or heart disease or something, they would not be listed as COVID deaths unless the COVID was a primary contributing factor. Most people don't die because of diabetes. They don't die because of heart disease. But when you combine that with COVID, it does accelerate their death. And as you can see, we've seen, the 41 to 50-year-old age group. Early on, we maybe had one death in that age group, and that's continuing to grow. 51 to 60-year-olds, which many of us still fit into that category. 26 people in our community, 61 to 70-year-old, 32. And, yes, the dominant number is 81 to 90. However, it is still, we're seeing younger and younger people who are in fact dying because of COVID. Location, Lafayette, you have had no one in Lafayette pass away that we're aware of who died of COVID, and that's a great statistic. Those who are connected to long-term care facilities, and back when I was talking to groups in June, it was 70% of our deaths were somehow associated with a long-term care facility, whether it be a patient or whether it be a doctor, or generally not a doctor, but a healthcare provider. That's who was dying. Now, overall, it's down to 55%. However, you just look at September on our charts, you'll see that only 24% were related to a long-term care facility, 76% were in the community. And as you track our deaths, as you can see on the chart, the blue, the solid blue shows community deaths. The greenish, beige, grayish color, those are the ones that are taking place or related to a long-term care facility. So that's also an interesting statistic. So as you all know, we've got state orders and we've got county orders, and we used to sort of say, well, sometimes the county prevails, sometimes the state. Pretty much it's come down to whoever has the more restrictive order, that is what is going to prevail. As we move forward, the state did come out a month ago with this new tier assignments, and fortunately right now we are in the red tier, and in order to go from tier to tier, you need to be in a tier for a minimum of 3 weeks. And you need to meet the next tier standards for 2 weeks in a row. And so currently we are hoping to get down to the orange. We're very close, but we're not there. You have to have 1 to 3.9 new cases per 100,000 per day, and you must meet this 2 to 4.9% positive tests. And so, as I mentioned, we moved to the red tier on September 29th. What changed was pretty significant. That's when we could go indoors at 25% capacity for places of worship, restaurants, movie theaters, museums. Gyms could open up indoors for 10%. All personal services, massage, nail salons could move indoors. Shopping malls could be up to 50% capacity instead of just 25%. Food courts could open up. Indoor retail stores could be open at 50%. And schools, after being in the red tier for 2 weeks, which we have reached today, did have the ability to open up for in-person instruction, again, with some state guidelines that dictate how that can happen. Most school districts have chosen not to yet go for in-person learning. And again, it's a really interesting challenge that they are trying to balance some very, very, very competing goals of parents, of teachers, and certainly of healthcare professionals. Our healthcare team meets weekly with our school districts, with our school district superintendents, and with the Office of Education to really work through these issues. And it's been a great partnership. So on our website, you can look what's open, what's closed. The governor did come out with new guidance with regard to outdoor gatherings, but he said it really should not be more than 3 different households. And you still should be wearing masks unless you're actually eating or drinking, and then you should be masked otherwise. This is not an open invitation for outdoor barbecues or wedding receptions in someone's backyard. It's something where, again, we're moving in the right direction. We want to continue to do so. So when do we move into the more moderate orange tier? So we're hoping, if our numbers hold well the next couple of weeks, to move in perhaps the first week of November. And so we've got to meet those standards, as I mentioned, for 2 weeks. So daily new cases have to be 1 to 3.9% per 100,000. We're not meeting that standard. We're about 4.6%. Positive cases we are meeting. It's got to be 2 to 4.9% of all the tests we do needs to have less than 4.9% positive. And right now we're at 2.3%. And then a new provision was added, which is called the social equity provision. And this was one that brought a little consternation to me because it broke down by neighborhoods, essentially by your census tract codes. Everyone had to be within 5% of the new tier's standards for percentage. And so disadvantaged neighborhoods would have to meet at least 5.2%. Right now, we're meeting that standard. Last week, we were above it. And when we first started this, we were significantly above it. And there was a concern that that would really, if we weren't able to bring these percentages down in those communities, it would really slow down moving forward. But we wanted to make sure that we recognize that those living in those communities, for the most part, don't have the luxury of working from home. And they often have frontline jobs. They're out there in the community, including in our community. And so this is a map that shows you with that equity provision, these are neighborhoods in Richmond, San Pablo, Pacheco, Concord, Bay Point, Pittsburgh, and Antioch, and in Walnut Creek in Rossmore. Interestingly, because of the statistics they utilize, Walnut Creek falls into that category. However, from what I understand from our health department, Walnut Creek is probably testing about 1% positive, which if anything helps sort of balance some of the numbers that we see. There is a new graph that tracks the progress of this equity provision. The gray, when you go to it, shows what we think we're at, but because we're now reporting data based upon the date the test is given, not the date we get the results, there's a lag time and it's not always equal. And so the gray area sort of shows you the trend where we're with the data we have and hopefully where we're going to end up. So things are looking very positive for us moving into the tier 3, the orange tier, assuming we continue on this trajectory we're on. So addressing the disadvantaged communities, this is something that wasn't new for us from back in March. We were doing many of our PSAs, our public service announcements in Spanish. We recognize that in some of our Latinx community, that's where we were having either cultural barriers, language barriers to not necessarily get this message out. It was also families that might have multiple families in one household. And so we really were doing a lot of work there, and we've continued to ramp up our efforts with more testing, working closer with the health partners that are working within those communities. Enforcement, when I say enforcement, not for people failing to wear a mask, but if we see whether, for example, a bar or a card room or something where they are allowing people to come in and not follow the health rules that would cause a massive spread of COVID, we're enforcing there, combining tests with flu shots. And we'll talk about that too, how important it is to be immunized for the flu this year, more Latino outreach utilizing ambassadors, more focused outreach using their trusted partners, many of which we developed during the census, and making sure that people are aware that we do have beds available for people to quarantine once they get a COVID diagnosis where they don't have to stay in a home and potentially expose other family members. We do have hotel beds available that we use for our homeless population, that we have available for people to just stay in at no cost to avoid spreading it further. We want you to get tested. More testing is always good. It still is available for you. It's free. Your insurance may be billed. You can schedule, call in online or scheduling. If you go to the county's health website, there's a Get Tested website. We've got still drive-through in Antioch, North Concord, at Partinez, North Richmond, Pittsburgh, San Pablo, San Ramon, and then walk-up test sites in these other areas of Brentwood, Central Concord, Pinole, North Richmond, and Walnut Creek. And right now our turnaround test time is closer to about 2 days. As many of you are aware, back in July and August, we're lagging perhaps 12, 14 days, which of course then it was very ineffective for contact tracing. Still have the fines in there. It's up to cities to whether or not to enforce within their city boundaries. Most cities are still choosing to be more educational. And we do have the DA's office involved working with state agencies like alcohol, beverage control, others when we have some more serious egregious violations and people just refusing to follow the health order. As I mentioned, contact tracing, we've got close to 200 people who are doing contact tracing. It's really 5 times the number of contact tracers we had pre-COVID. And right now they are able to contact about 76% of anyone who receives a positive COVID test. And this information is also, there's a whole dashboard just on contact tracing. herd immunity is a really interesting discussion that I threw this up here, and I think we'll have Dr. Warren can certainly weigh in on it. Dr. Patrick Joseph, who heads infection control over at San Ramon Valley Regional, was on a meeting with me with Mayor Clarkson of San Ramon, and he pulled up this chart that I thought was very instructive, because I get a lot of emails from people saying, what about herd immunity? Why don't we just keep the old people, the sick people, have them stay home, and everyone else go around, get exposed, we'll get herd immunity, and then we'll be fine. And what he pointed out was we really are very far from that. We would need to have close to, right now, even in New York City, for example, which was the hardest hit, they've only got 20% of the people had the antibodies. And right now, of course, we don't know how long the antibodies actually last in your system to protect you. We would have to get close to 60% of the population would have had to be exposed or vaccinated in order to have herd immunity. And so his opinion was, until we have a vaccine, you really will not see herd immunity in our community. And on the left, you see charts of other very strongly communicable diseases and what level of herd immunity threshold they need, some of which are much higher in these much more contagious diseases. So we do still hold a monthly ad hoc COVID meeting. It happens to be this Thursday at 1:30 p.m. and you can find that on the County Board of Supervisors agenda website. It's a Zoom meeting, and we have updates from our health officials. We also answer questions that have been submitted to us ahead of time, and then the public does have an opportunity to ask our health officers additional questions. We will be having Lynn Mackey this week, who could provide some more insight as to some issues related to schools. This we encourage you to go to Know the Risk. Again, it's still out there, and my office is still here to serve you, to help you throughout this. And finally, if you are not getting my weekly COVID update, you should, because we send out some great information. So that is my update. And I believe Dr. Warren is here, and I'd love to introduce you to Dr. Tom Warren. And he is one of our health officers. He works with Dr. Chris Varnatano, along with other health officers, really looking at how we can best address this pandemic in our community. So welcome, Tom, and I'm sure you're all delighted to meet him.
Absolutely.
I'm delighted to meet you all. Thank you, Supervisor Anderson, for inviting me to join you to the Lafayette City Council meeting, and thank you, City of Lafayette. And I think Supervisor Anderson wanted me to make just some additional points, and could of course be available for discussion as well. I've got to say that I just called you Dr. Anderson, and you know that presentation was worthy of an epidemiologist or a health officer. So
I do have a Juris Doctorate, so I think we can start calling me Dr. Anderson.
Absolutely.
All in jest.
But that was really a great overview of the data. I'm not sure the time constraints, but let me just briefly talk about maybe a little bit more on some of the issues and side issues. And one is just to reemphasize the positive trends we're seeing. Of course, we've looked at all sorts of data. We've tracked different ways of looking at the case rates and the number of infections and hospitalizations and so on over time. And we've eventually gotten to a pretty good system of kind of key metrics, just a few of them that are really meaningful. And the state has really focused us in on these couple in particular, the cases per 100,000 per day that Supervisor Anderson talked about, and the testing positivity rate. Those as being really, very close to, the best outcome indicators of showing how we're doing in controlling, preventing and controlling this virus in the community. So according to those, we really have been doing well. I think we look back at the epidemic. The early days, we didn't even have enough testing to have an idea of how much of it was out there in the community. But, in the late spring, we rolled out a lot more testing, late spring into early summer. And as we kind of got the first wave under control, we started to open up more, and we saw, which was across California, and not quite as bad in the Bay Area as the rest of California, but across the Bay Area and Contra Costa as well, increasing infections as we opened up. So, we had to kind of say, whoa, slow it down, and really, re-emphasize the social distancing, the hand hygiene, the different things that we needed to do in order to protect each other while we were keeping a lot of things still closed. and rolling in the face coverings, masking, and so on. That's so important in preventing transmission. Doing all that, we bought ourselves some time in terms of scaling up the testing capacity and the contact tracing capacity that was really needed in order to allow us to more safely reopen more. So we've done that gradually under the state's leadership. At first, it was really in the county's hands, and then the state stepped forward in late June, early July. We fell into more of the state a framework for proceeding, and in the start of September, this new framework, or this new blueprint for a safer economy, that 4 tiers that Supervisor Anderson talked about, and I think you all are very familiar with. So according to that, we've really made progress from things. It was kind of, you couldn't just say on July 1st say, okay, we're gonna cry hold and put a pause on everything and expect everything to follow in terms of reduced infections right away. There's a lag time because there's an incubation time and so on and so forth. That means you have a couple weeks before you start to see the effects. But while we did peak in early mid-July in our numbers, we've seen really tremendous improvement since then. As Supervisor Anderson talked about, our cases per 100,000 per day, which are right now at 4.6 and need to be less than 4 consistently over a period of 2 weeks in order to move to the lower tier. That's down from, we were up around 19. So we're right around 4.6 now. We were up around 19 in mid-July. So we've really come down steadily since then. And in fact, just at the start of September, we were at 9. So we brought it down to really less than half of start of September since then. Testing positivity also has come down, very nicely. We were actually well within the tier 3 targets now, although we do need to pull that health equity metric. We do need to pull it down yet even some more for our lowest quartile census tracts on the Healthy Places Index. But we're actually looking like we're getting there as well through really strong community outreach efforts and strong testing efforts. So, there has been kind of disproportional impact at different parts of the county, but we're starting to see the progress more and more across all areas. So I think we can feel I'm hopeful. Things look very good for us moving into the next tier within a few weeks. So these and the hospitalization rate, that's another one that Supervisor Anderson said that we really look at strongly. And back in July and early August, we were up around an average of 100 patients hospitalized in county hospitals on a daily basis with coronavirus, and now we're solidly in the 7-day average. It's right around 31, but right now we're in the 20s, and so that's actually looking really good. So overall, we've been on an improving trend, and that's allowed us to start to reopen more. And the key thing is we need to protect that as we reopen more in order to allow us to open up more of the economy and society and schools as we know we need. So one of the things that we need to talk about is we need to always emphasize is that more testing is needed. And we were really struggling with this back in July and August. In July, maybe we didn't have enough capacity. By August, we had enough capacity, but we still maybe didn't have enough sites open. We were not fully subscribed in terms of our daily appointments and so on and so forth. But we weren't totally as accessible as we needed to be. And really from August into September into now, we've really expanded that testing availability. We've also worked with our partners to make sure that in all the systems, not just the county system, but also the private systems, the tests are more available. We've seen that in some of the large networks in our county, that it's a lot easier to get tests now. You don't have to kind of jump through as many hoops. And we really want everybody to know that, we need more testing. Currently, I think we are at around, our 7-day average for tests in the county is now around 3,200 per day. That's well more than the state average and the state targets, but it's actually less than our overall targets. The reason why we need more testing is this: in order to find all the infections in a timely way, we need to test more and more and more. We have very rapid turnaround in the test results now. So if you can turn that unfortunate positive finding of a test into fast identification, letting people know to isolate, starting to trace contacts so that their contacts can also be tested and quarantine or isolated if needed. These things are so important in shutting down the transmission. So we need more and more testing in order to do that. We also need more and more testing in order to, so that in fact prevents more infections. The more testing we do, it turns directly into prevention of additional infections, and that's so important. But the other thing is from the standpoint of the economic reopening and the social reopening, we know that we're more protected and it's safer for us to actually move forward with reopening if we do more testing. And that's why the state has actually built that into their metric system, so that they actually, if we're testing beyond the state targets, they actually will adjust our case rate down to allow us to move quicker. So that's actually really super important. So get the message out to everyone. Please go out and get tested. If you haven't been tested yet, go get tested. All your constituents, everybody in your communities, even if people think they're low risk, but especially for people that are higher risk of exposure. And that's, people that are out working in public facing jobs, and healthcare workers and first responders and people working in retail businesses that with a lot of contact with the public. Anyone who's in that sort of a situation should probably be tested once a month, and now the availability is to do that. So we hope that everybody turns out. Supervisor Anderson passed along the information of the county testing websites, the county testing numbers, so that people can, if they don't have it through their private provider, if they have a private provider, definitely can get it through the county, and that's really important. I think there was also some thought that it would be important to talk about additional testing that's becoming available. Early on, we all heard about antibody testing. Okay, antibody testing, let's not talk about that because it doesn't really diagnose. It may be of use down the road, but the really important thing are those diagnostic tests. And so the test that was rolled out early on, and we've developed through many different means and forms, is the PCR test. That's a nucleic acid test to test for the actual viral material and viral genetic material. And that's still the gold standard, but now we're increasingly having the availability of antigen tests as well. And these can also be very, very sensitive and specific, so they can be almost as good as the gold standard PCR test. And what's more, they can be, in many cases, done much more easily, point of care, much less expensively, and so on. So getting more access to those tests as they're being rolled out by manufacturers and approved by the FDA is critical, and that is starting to happen. Some healthcare systems do have rapid point of care testing and some antigen testing available. That's mostly in the hospital settings and emergency rooms, but we are going to be getting more of the antibody tests. The federal government has actually procured huge amounts of this Abbott Binax rapid test, and that is going to be coming through to the counties. So we're actually anticipating that, getting our first tranche of those at some point. We'll be planning for how to roll them out. So these are going to be very important testing modalities in the future. Some questions about how widespread it is throughout the county, and actually why the county has to open up as a whole county and not by zip code or area, since there is really potential areas of the county. I think you all know that. Supervisor Anderson just shared some of the numbers for Lafayette. If we look at some of the areas of Central and South County, some of the cities have had case rates which may be 5 times less or maybe even 10 times less than the worst affected cities in other parts of the county. These have, that's one of the reasons why the state has put in this, the health equity metric, is because the 25% of zip codes of census tracts rather that are in the lowest quartile on the Healthy Places Index, they really have been disproportionately affected. And areas that are lower socioeconomic status and more minorities, and particularly more Latinx and Asian Pacific Islander, have seen really disproportionate burden. So you think, well, why can't we keep the areas that are more heavily impacted, close down more and open up more in the areas that are less heavily impacted. And that is because I think, we all know we are, we don't have walls around our communities. We interact and we protect everyone, including protecting ourselves in our communities, which may have lower burden by maintaining those standards, because we don't go by zip codes on our interactions in the store or in the restaurant or in our church or in work. We are a broader community, and we do mix. And it would be actually quite unfortunate for the less affected communities if they opened up more or didn't keep their guard up, because then you would find more of it in your own community. So that actually, I think that's a pretty straightforward concept. But we protect ourselves, we protect our households and our immediate communities by protecting everybody and doing it all the same. Want to mention just briefly about flu, and the fact is that we do worry about coronavirus. We worry about a surge in the wintertime, and there's all sorts of reasons for that. It's because people go indoors, people are less outdoors, people are maybe mixing more indoors. It's because there's a lot of holidays that bring people more into stores together and then into their families and their dining rooms together. And so there are a lot of risks, and we know that that's also the time that the flu hits. And without coronavirus, the flu in and of itself puts a big strain on our hospitals. Our hospitals fill up with people who are sick, and so the best thing that we can do is to protect against the flu. So by protecting against the flu, we keep our hospitals more viable, so we can also handle coronavirus. We also protect each other. We know that the medically vulnerable and the frail elderly are much higher risk for both flu and coronavirus. It is possible to get both at the same time, we just need to protect. We need to protect our families and our communities. So it's up to everybody to get their flu shots. If we can really push flu shots this year, we can, keep our fingers crossed, hopefully have a less impactful flu season and keep everybody safe. So in preparing for flu, we're really rolling it out around the county. We've already, just in the first half of October, since the vaccination season started, we've already administered about 2,700 flu shots so far at different county sites. As of October 12th, more than 2,000 flu shots have been given at COVID testing sites that are also offering free flu vaccine, and that's about 2/3 of our initial allotment in less than 2 weeks. Nearly 1/3 of people getting tested at these sites are opting to get their flu shots as well. Of course, a lot of people get their flu shots at other places, pharmacies or their providers. There have been 3 free community vaccination clinics at this point. We are doing, free vaccination clinics open to everyone at a variety of sites around the county. The next one is the flu shot clinic at the Monument Crisis Center in Concord, which is tomorrow from 9 to 12. There's information about the free flu vaccine clinics up on the county website, but I'll just say that in addition to tomorrow at Concord, there's Sunday in Richmond, Saturday the 24th in Concord, Thursday the 29th in Pittsburgh, and Friday the 30th in San Ramon. So there's, in addition to normal provider networks that people go to for their shots and the pharmacies if they have insurance, there are also these free clinics, and that's really, really important. I want to mention just briefly about the outlook for coronavirus vaccine. And I gotta say, we don't have crystal balls. We're all reading the same things in the newspapers. I myself was part of HIV vaccine research back in the 90s. It's a long, slow process to do vaccine research. I'm amazed that they're pushing through these trials as quickly as they are, with several candidates now for U.S. candidates in phase 3 vaccines. I don't think we have a crystal ball in terms of exactly when they're going to be available, but we need to be ready for it. So we are preparing. The CDC has led the way with kind of a playbook for planning. A lot of this planning has been done already previously for different pandemic situations, pandemic flu. It's basically the same sort of formulas in terms of trying to roll out a vaccine that will be available probably in small numbers at first, and then increasingly in greater numbers to different groups in the community. And there's a plan for phase 1, 1A, 1B, phase 2, phase 3 of vaccinations locally. And, that conversation has been started. It's been started within stakeholders in the county provider networks. Providers will have to be certified and credentialed to get supplies of the vaccine once they become available. There are different data systems that are being developed for it. There's the whole supply chain and cold chain logistics, which are very complicated. Well, some of the vaccine candidates have 1 dose, some will need 2 doses. Some of them require -20 freezers. There's one candidate that requires -70 freezers, which most people don't have. So that planning work is happening from the federal level down to the state and down to the county health department as well. I've just started myself participating on the state's vaccine task force for the county, but our county team, we have a branch already established within our response network to be working on this planning. So that's underway. I want to just say something briefly about schools. I think we know, and Supervisor Anderson presented on the situation regarding schools reopening. We know that while we were in, over the last several weeks, that we'd already been working under the special waiver process for certain small schools, for elementary grades to get waivers to open. A limited number of schools have done that. We've had good experience. That was a very kind of highly regulated application process involving both the Office of Education and Health. But now that we are 2 weeks, as of today, 2 weeks in the red tier, that's the point at which the other school systems can potentially reopen. Now, we know that all the schools are working on their reopening plans, and it is a district by district consideration. There's been a lot that the health department is very involved with consulting with school districts, as well as the Office of Education on these plans. But at this point, it becomes up to the school district and not up to the Department of Health to say yes or no. There's guidelines in terms of how they can do it, and each school district is developing their own plans. Now, we also know that probably most school districts are planning to not start reopening to in-person instruction in any sort of a large way until after the winter break, at least through the fall time. It'll probably continue to go as it goes. There may be some interest in reopening for special needs students, some in-person learning in some districts. But just want to say that, we're here to support the school districts in doing this safely. This is so important for our communities, both to give the kids the education and the socialization that they need, also to keep the kids and their families and the staff and the communities safe. So that's really, really a really important thing that's moving forward now. And finally, I've taken a lot of time, so let me just say that it's really important that we keep our eye on the prize and not let our guards down. We know that as like places in the Northeast of the United States, for instance, or in Europe, that had really high numbers earlier and then really brought their cases down for several months. They are now trending back up. This is the dynamic of this pandemic, and we are facing the same thing. So we are currently trending down, and we're reopening. If we don't do it carefully, it will start to go back up again. And so we really need to keep our eye on the prize in terms of that, and know that just because the economy is reopening and certain parts of the society are reopening and our places of worship to some extent and so on and so forth, we can't go back to life as usual. We all have to do everything we can to protect ourselves, our families, our households, our community, in our county. We need to protect our children and our vulnerable elderly folks who may be in our communities or in our families. And so for that reason, we have to remind ourselves and remind everybody in our communities that just because it's okay to go back to the store, because it's okay to go back to some limited activities, it doesn't mean that we can go back to our normal way of life, particularly in terms of socialization. Large gatherings are still not safe. There are clear guidelines about it. Just because we can go to restaurants doesn't mean that we should be making social plans with 3 different households this weekend and 3 more 2 days later to meet at the outdoor eatery, because we need to keep in mind that all those basic prevention actions that we need to take are still there, and that's what we need to maintain in order to keep this going. Along those lines, reinforcing social distancing, reinforcing wearing face masks or face coverings, hygiene, staying at home when we're sick, reinforcing testing. Everybody needs to be tested. Who should be tested? Anybody who feels sick should be tested. Anybody who's a contact to somebody who's been sick should be tested. Everybody should be tested. Everybody who's in public facing work in critical occupations should be tested more frequently, even if they're asymptomatic. Let your communities and your friends and neighbors know too. Sorry, I've gone on a little bit. I hope I haven't taken too much of your time, but thank you for allowing me to contribute.
Thank you very much. And let's see if there's any questions for Dr. Anderson or Dr. Warren from the council. No? Okay, do we have any public? Okay, Councilmember Bliss, go ahead.
Yeah, I just want to unmute myself. First of all, Dr. Warren and Supervisor Anderson, thank you so much for making the time to be here tonight and give us this update. Great information here, and I really appreciated the note of we're making progress, but we have to remain vigilant. I think that's a great message for you as county level officials to bring out to our communities. I have 2 questions. The first one is probably for Dr. Warren, and the second one is probably for both of you. So just my question for Dr. Warren is, at the sort of national level and somewhat at the state level, you're starting to hear, you mentioned your concern about a potential resurgence of the virus. At the national level, there's starting to be a fair amount of press about concerns, particularly on the East Coast, about the colder weather pushing people inside and creating a greater risk of coronavirus spread. Obviously, our weather out here is different than the Northeast, but to what extent does moving into fall and winter pose an increased risk even for us in the greater Bay Area, would you say?
Mm-hmm. Well, it may depend on the weather, and we can't necessarily predict that. I've heard predictions we're going to have a La Nina season, which apparently gives us a 50-50 chance of either being very dry or very, very wet. So, still doesn't tell us anything. No, I mean, I think that we certainly go more indoors in the winter time here as well. I think that it may be less than, say, New York from that standpoint. Outdoors is certainly safer, but what are we doing? Okay, so I've been indoors a lot over the last 3 or 4 months. I've been working all the time. I've been indoors in the clinic. I've been indoors at home or in the office. It's how we go about it. Outdoors is safer, but we can be safe indoors if we follow those basic principles of social distancing, good hand hygiene, maintaining your space between people, not having in-person meetings, right? I mean, not going into the office if you don't have to, and all the different things that we do in order to prevent on an individual level. Because I think where we're going to slip up, bringing it more indoors does pose more risk. But the wintertime also poses a lot more risk in terms of schools are going to be more more active. There's going to be some return of in-person maybe at some point. That's bringing people together. We have the holidays coming up, and people do a lot of things at the holidays. They have, and I fear that folks will not want to give up their closely held and very important traditions of getting together with friends and family and things like that. We have to remember that it's not safe to go back to business as usual. So I think that the reasons for the risk are many, not just the weather. It's also the fact of maybe being lulled into a sense of feeling like we're doing better and we're safe, and so we can let down our guard. So we need to keep that guard up.
Thank you. And that in some ways may connect with my second question, which is, and this is for both of you, because the county has done a great job of sharing information with the public, with policymakers at the local level like us. Supervisor Anderson, your regular emails and updates have been really fantastic, and just a lot of great, very timely information. I'm just wondering, since you both have done a lot of work sharing information with the public in recent months, kind of put you on the spot a little bit. If you had to pick one thing or one message about COVID that you wish more residents of Contra Costa understood or knew, what would you point to for that?
Well, I was just, there's a lot of what I'm calling COVID fatigue out there. People are just sort of like, I'm done with it. I did this for 6 months. I wore my mask. I washed my hands. I didn't get to hang out with my friends. I'm just done with it. If I get sick, so what? And my message is you can't let down your guard now. And I think Dr. Warren reemphasized that as well. We're too close to really being at a really good point. And those things that people think are constraining their liberty, like wearing a mask or not getting together, those are the things that allow us to open up more activities, to open up our economy just by doing those really basic things of, yes, wear a mask every time you're out in public. It protects you, it protects other people. Don't go out when you're sick, wash your hands, and don't bring multiple households together, when you don't need to. If it's a religious worship service, follow those guidelines, have 100 people or less. So just don't let down your guard yet. We're too close.
I would say exactly the same thing. I think Supervisor Anderson said it very well. People just, however we can get the point across, we have to get the point across that in order for us to go back to doing some of these things and not get in real trouble and not bring it home to our family or our grandmother, right? In order to do that, we have to do it according to this way. And this is the way we can do it safely. Please do it this way. And don't go to parties, so.
Thank you. Those are excellent and very helpful replies. That's all my questions, Mayor Anderson. Thank you.
Okay. Any other questions from council members? Or do we have any public comments on this item?
All right, I don't see any now, but I'll just remind folks if they do have a question or public comment to use the raise your hand function or *9 if you're calling in. So we'll give them a second there, Mayor Anderson, to do that. And okay, at this point, there are no hands raised.
Okay, well, I want to thank the two doctors and our supervisor for a great presentation, very thorough. And thank you. And we may get back to you again to kind of update at some future time. But thank you very much for taking the time tonight. Okay.
Thank you so much.
Thank you so much.
Thank you. Okay, with that, we'll move on to our next item, which is on mask wearing.
Okay, let us take a look here. And we have coming in, 1 second. Okay, Dr. Huang.
Hi, can you guys hear me?
We can, welcome.
Thank you for having me. Could you also let Dr. Kendall in as well? He's my partner in crime, and he's also available for the call.
Okay.
And we cannot see you, Dr. Wang, but we can hear you.
Okay, there we go.
There you go.
Okay, Nice to see you.
All right, Dr. Candell is now joining the meeting.
Okay, so I'm going to share my screen. And thank you, City of Lafayette, for having me. It's a pleasure to be here. So,
hey, Yenjin, real quick.
Yes.
I wanted to quickly say I asked Dr. Wong to come in and talk to us today, and I want to just say the elephant in the room is about. I asked her to do this weeks and weeks ago, before any of the current issues, before our president got sick, before any of this got politically very hot. And I just want to know that this was very candidly thoughtful and supposed to be a very educational thing, not at all being nothing involving any of the current issues around this topic. So I wanted to share that with everybody first.
Okay. Thank you for that, Susan. And yes, I can confirm that Susan did send this invitation to me a long time ago. So for those of you who don't know, Dr. Candell and I practice in Orinda. Dr. Candell lives in Lafayette. I actually am a director of infection control over at Alta Bates and Summit. So the numbers that Supervisor Anderson and Dr. Warren were covering were literally my reality over this summer. So it was a tough time. Okay, so let's see if I can go forward. Oh, hang on just a sec. Okay, so why should we mask up? And I thought really hard about this because you know, speaking to a city council is different from speaking to a room of doctors. I don't want to overwhelm you with lots of diagrams and technical data and like the intricacies of studies. So I wanted to distill this. We mask up because we need to decrease transmission of COVID. And especially in situations where you can't maintain good separation between people. Okay, so that's the bottom line. We need to mask up to prevent transmission. Okay, this is one of the most effective ways of persuading somebody to, or persuading someone about the importance of a mask. Up here is the link at the New England Journal of Medicine. They've actually got a video of what a sneeze looks like. So once you watch that and you get grossed out, remember, when you sneeze, large droplets settle 1 to 2 meters away. That's 3 to 6 feet away. Smaller droplets, which are produced during a sneeze, remain suspended and they can travel further. They can actually go as far as 6 to 8 meters away. So you can see that even if you're distant from someone by 6 feet, sometimes you're not quite protected just by that distance. And that's why it's important to wear the mask. This is astonishing. There's up to 40,000 droplets released quite rapidly when you sneeze. And the same is true for loud talking, yelling, shouting, singing. So these are all equivalent. So if you haven't watched this, go watch it and you'll be doubly motivated to wear your mask. And Brian, please chime in at any point if I've missed something or you want to add something. So there is evidence for the efficacy of masks. There's mostly previous studies on respiratory viruses. So SARS, which was the first SARS that came out of Hong Kong, flu virus, there's lots of studies. People have done meta-analyses. So it's all out there for you guys to look up if you want to. But I thought if you're going to really try to emphasize to someone the importance of wearing a mask, these are a couple of good examples. Okay, so again, here is the CDC MMWR report on this particular case. If you guys don't remember, in Missouri over the summer, 2 symptomatic stylists from Great Lips worked for several days. They were symptomatic, they were sick, but they wore a mask. They actually saw 140 clients, were around 6 coworkers, and there was no transmission. Now they were lucky, but because they were masked, nothing happened from that particular situation. So that's one really great real world example of why a mask is really protective. Okay. Next is, if you look at Arizona, if we all remember over the summer, and again, this data is all at that link at that that website that that I put up there. In Arizona, when they lifted stay-at-home orders, the case numbers shot up tremendously, 151%. Once they instituted masking, limiting public events, and closing bars and restaurants, they saw a decrease in 75% of case rates. So you could say, well, that wasn't just, they did everything, not just masks, but masks are a big part of the strategy of controlling COVID. Okay, so those are two really great examples. So I often encounter this, or sometimes I encounter this. Masks are a personal choice, and making me wear one is an infringement on my rights. You're interfering with my liberty. So I actually get that sometimes in patients that I see, even in the hospital, people who are coming in sick, who should be concerned about COVID. They're like, I don't want to wear my mask. Okay, so here's some replies. You want to protect your loved ones. Grandparents want to see their grandchildren. You want to protect your kids. You want to protect your grandparents. And that's how you do it, by wearing a mask. This is a really big thing. Masks make it more likely that your hospital system won't be overwhelmed, so that it can take care of you when you come in with that heart attack or stroke. At the height of our surge, I can tell you, over at Alta Bates and Summit, we had a separate COVID ICU, both at Alta Bates and at Summit. We had a separate floor unit for regular medical patients who had COVID, and they take a lot of work. Our nurses and doctors were getting tired, and we had to, restrict the number of surgeries that we were doing. We had to do all sorts of maneuvers to make sure we could take care of everybody who needed to be taken care of. It's estimated that probably I saw a recent study out that probably there's an extra 20% increase in mortality rate around the same time as COVID, and that's probably related to lack of access to medical care around this time. So one thing you should remember to always remember, these official case counts that are coming out, they are undercounts. We know that they are undercounts. The actual death rate is probably higher than what we're seeing. I just threw this in there because I wanted to show everybody, well, why does a COVID patient take more work? They're sick, yeah, and you need to be careful of them. But this is what a nurse or doctor has to go through every time they walk into that room. They have to put on an N95 mask. They have to put on this special filtration headgear, a PAPR unit, for extra protection, because the nurses are in those rooms for quite a long period of time. Then they've got to put on the gown and the glove, make sure they're covered up. And that takes about 5 minutes. If there's something wrong with this PAPR unit, this particular instance, it took him 10 minutes because he had to fiddle with the unit to make sure it was working properly. So this is only one reason why why COVID patients take so much of our healthcare resources. And why we should all be concerned and try to decrease transmission and rates. Dr. Kendall sent me this early on, and I have to tell you, I'm married to an ophthalmologist. So I should have changed this to wear a mask if you don't want an ophthalmologist treating your pneumonia. So seriously, if you all remember, in New York City at the height of their epidemic, podiatrists, dermatologists, and people whose scope of practice was not acute care medicine were actually being dragged into the hospital to deal with the tremendous surge in medical care. So every time someone says, I don't want to wear a mask because it's my individual right, well, you can remind them that, it actually affects all of us, and not wearing a mask is actually putting everybody at risk. As Supervisor Anderson said, masking and following these stay-at-home orders actually enable us to get to where we want to be faster. So it makes it much more likely that we can do things like this. That's my family and another family at a restaurant enjoying ourselves. We want to get back to that. And the faster we get down transmission rates and case rates, the more comfortable we are at sort of gradually, cautiously going back to regular economic activity. And I think a lot of people who don't want to wear masks also, don't believe in lockdowns and shutting down businesses. I think if we all do those things, wear a mask, socially distance, we will all be able to open up faster. Our economy will recover faster. This is a good one. I don't need to wear a mask because I'm not in one of the high-risk groups. I have to remind everybody, actually 60% of American adults have at least one risk factor for severe COVID. So statistically, you may say that, but you're very likely to have a risk factor that predisposes you to severe COVID disease. And part of that problem is that 40% of us are actually in the obese range. Obesity is quite a big risk factor for severe COVID. Here's another one. I don't know anyone who is seriously ill with COVID. They weren't very sick. Well, up to 1/3 of people with, quote, mild COVID symptoms, meaning they never went to the hospital, they never had to be on oxygen, actually have prolonged signs of COVID. They have, I've got one patient who had a fever for 4 weeks, high fevers for 4 weeks. She still has brain fog. She's still got neurologic symptoms, breathing problems, and tremendous fatigue. So even mild COVID can have potential consequences in the long term. This is not to scare people, but this is another complication of COVID that we should all be aware of, and it's another reason to try to reduce case rates and transmission. Kids who have COVID, sometimes they're asymptomatic, they don't appear ill, but 3 to 4 weeks after a presumed infection, they can actually present with a life-threatening illness called multisystem inflammatory syndrome. It looks like Kawasaki's disease. They get really, really sick. They're critically ill. And if you look back at this series in New York, this is a case series from New York. Some of these children had no symptoms of COVID. It's just that people around them had tested positive for COVID. And if you looked at them, they had COVID antibodies. So this sort of just emphasizes the fact that you just don't want COVID, period. Why run the risk of putting your child through that? Okay. The other thing is we are starting to see some case reports of adults coming down with this similar syndrome. I'm not sure what we're going to call it yet, but it is quite similar. And again, it falls into that big umbrella of complications of COVID, of which we do not know all of the complications. Yep, I think that's it. Oh, one last thing I should show you. Dr. Kendall wanted me to point this out. Let's go to this. Can you guys all see this IHME projection?
All we see is thank you questions.
Okay, hold on. Let's see. Let me go to this one. There we go. Okay. Can you see this now? Okay. Yep. So if you look, this is the University of Washington projections, and this is just the United States. As you know, we're at death toll around 210-ish thousand, 215,000. The green, the top line is if we kind of ease up on everything and just kind of go back to normal, we're looking at 400,000 deaths or something like that by February of next year. The middle line is this line right here is if we just kind of keep doing what we're doing, being cautious, but not really universally masking. We'll have a little bit of a decrease, but not much. If we all universally masked, and that's the low green line right there, if we did that, we might reduce our death counts by 80,000, which I think is a pretty good trade-off. Are you willing to wear masks so that 80,000 less people in the United States die? I think most people would say yes. So that's another again, evidence or motivation to put on the mask. So, Brian, do you have anything else to add?
Yeah, just the things I want to add, and I'll be very brief because this has been going on an awful long time, is everyone else has kind of talked about the system-wide, county-wide, statewide. I work on a personal level day to day with patients in my office, and it's amazing how things have progressed. And I think we all started out thinking, all right, this is a sprint, 6 to 8 weeks. We're going to be you know, we can do this, but it's become a marathon, and we've got months and months and maybe a year to go before any semblance of normalcy comes back. And I think the COVID fatigue as Supervisor Anderson talked about, or pandemic fatigue, is really there. People are just getting blasé. They're thinking, you know, for a long time, and none of my patients said, I don't know anybody who's had this. Nobody's died from it. Now, mostly everybody I talk to, and we're seeing them to screen almost every day, was exposed to somebody, a coworker, their spouse's coworker, someone who works in their household, somebody who's doing construction in their house, whatever it is. We're seeing a lot of people, and we're kind of numb to the fact that everybody could be somebody to spread this, and you can't see it. Asymptomatic people spread this disease, and I had a good example the other day where a patient of mine came in and he wanted to be tested. I said, well, what's the story? He says, well, I was playing golf last Friday with two of my buddies, and we were outside and mostly wearing masks, and all that was fine, and it was a good day on Friday. Said by Monday, his two golfing partners both had symptoms, and by Wednesday, they both came down with COVID. So you don't know by looking at somebody. We used to talk about it, and we still do, and for, you know, HIV, you don't know where everybody's been. You don't know, they may be really good at home, but, you know, one night they went out, and, you know, nobody can socially distance when they're drunk, and people get together, they could be asymptomatic and you have it. So, you know, this is a marathon. Don't get numb to this. And the other thing probably to point out is that people have been mostly avoiding seeing their primary care doctors. I don't want to go into a doctor's office. There's, you know, COVID there. We try to keep it as safe as possible, and I think most medical centers do. And just I want to encourage people not to forget about their chronic illnesses. You know, you could be home and shuttered, and your heart disease and diabetes and everything else can be getting out of control. So, you know, check in with your doctors. And then the last thing, check in with people around you. There's quite a bit of mental illness going on, anxiety, depression, suicide rates up. You know, look for your vulnerable friends that are isolated, your parents, grandparents, those kind of people. Just check in on people and have them check in with their doctors too if you see depression or anxiety.
Okay.
That's all I have.
Very good presentation. Thank you both. Do we have questions from council members? Vice Mayor Candell.
I was hoping somebody would show me how to put the mask on right and make sure it's over your nose.
Yes. Yes, it must cover your nose and your mouth. Yes, I'm sorry, I didn't cover that very basic thing. It has to cover your nose and your mouth.
Look how quick you guys are.
A surgical mask, pinch it so it covers the nose well. Make sure it's over your cheekbones and it's underneath your chin. So this is not correct. This is not correct, and this is definitely not correct.
So that brings up another point, and I see it in my office every day. So everyone's got to have a mask on when they come into the office. But, you know, they're sitting as, you know, we drink coffee while we're waiting for people, make them wait, makes us feel important. No, we're busy doing other things. But so they're waiting in the room. When I come in the room, the mask is hanging like this, it's over here. The point is you're not spreading everything from your air and your breathing all over the room where other people and other patients are. So if you're in an inside environment, somebody walks away, keep your mask on because you're still spreading.
Okay, good advice.
True.
Other questions? So do we have any public comments or questions from the public?
Okay, no hands are raised at this time, but let's give everyone a chance to raise their hands, and they can use the raise your hand function or *9 to do that if you have public comment or a question. And Mayor Anderson, no hands are raised at this time.
Well, thank you both very much. It was good information. We really appreciate it. And I think we'll all be doing a better job of covering our faces now.
Thank you.
Thank
Okay.
you.
Thank you very much. All right, we will now move on to a report from the Assistant from the Register of Voters. Elections update.
Okay, hold on one sec. And here we go. Okay, Scott, you are in the meeting, so go ahead and unmute and start your presentation anytime.
Great, thank you very much. Thank you for the opportunity to come and talk about voting during the 2020 pandemic. What a setup. I could not have asked for a better setup for this presentation. Most of you know that back in May, the governor issued an executive order directing county election officials, because of the pandemic, to mail a vote by mail ballot to all voters for the fall. A few weeks later in June, he came back and said, but you also need to provide an adequate number of in-person voting options for voters in the fall. This has turned out to be.
Let me just tell you, this is Mike Anderson. We cannot see you. We can hear you just fine. So if you think we can see you, we cannot.
I can't see me either. Let's.
Oh.
There we go.
There he is.
Okay. Okay. Here's my friendly face.
There you go. Thank you.
Okay. So over the summer, we had a lot of work to do to plan this upcoming election. How do we mail a ballot to everyone at the same time, provide safe and in-person voting opportunities? But I have to say that planning was the hardest part, and we're really gratified with how the public has responded. I can't advance my slide here. Hold on a second. Okay, here we go. Okay, so because of the order for issuing ballots.
But we can't see your presentation. Are you sharing the screen?
I believe so. Hold on, maybe I messed this up. Hold on 1 second.
Yeah, it's the green button at the bottom, share screen with the arrow pointed up.
I'm still having difficulty. Please bear with me here.
Okay.
Okay,
There
can
we
you see
go.
my screen now?
Yes, we can.
Yep, looking good.
I apologize for that. Let me get back into presentation here. There we go. Okay. There we go. So because of the governor's orders, both for mailing a ballot to everyone and having in-person voting opportunities, a lot of people thought that there was going to be a lot of changes for this election. But actually, for most voters, there are really no visible changes. 77% of our voters have already requested, had previously voted by a mail ballot. So the only voters that for whom this is going to appear differently at all are those who have voted in person in the past. We have reached out to them and informed them about the new parameters and rules. And by all indications, they understand that that they are receiving a ballot and appear to be casting their ballots that they've been mailed. So again, most things haven't changed except that there's going to be COVID precautions visible at all of the in-person voting locations and for all activities associated with voting. Masks, of course, hand sanitation, social distancing, but that's the only thing that's going to look different to most voters because most changes are behind the scenes. So we're a week into voting right now, a little bit more than a week. So I thought I'd give you a little snapshot, a thumbnail of where we're at. So as of today, we have 691,360 registered voters. And in the city of Lafayette, there are 18,773. For this election, there are 310 different ballot variations reflecting the different offices that voters are eligible to vote on. In the city of Lafayette, there are 19 different variants of the ballot. Countywide, there are 957 voting precincts, 17 of which are in the city of Lafayette. We are estimating the turnout for this election to be about 86%, which is about 600,000 voters. You have received your ballots already, I hope, I expect, and you will notice that each ballot contains 5 cards. So if you do the math, 5 times 600,000, that means we have 3 million ballot cards to scan, to prepare and scan when all said and done through the election. And I know several of you might be interested in knowing when will we certify and when will we be done. And our anticipated certification date is the 30th of November. So as of today, we have about 100,000 ballots in our possession returned by voters, which already represents a 14.5% turnout for this election. In the city of Lafayette, we've received 2,640 ballots, which again is about a 14% turnout, tracking with the overall county trend. Of these 100,000, 65,000 of these ballots have been returned by mail through the USPS. And in Lafayette, that is 1,390. There are many voters are concerned about knowing whether or not we receive their ballot. There are a number of things that voters can do to check their ballot status. To just check on your status, I suggest that you go to the county's election website, which is cocovote.us, and look yourself up, and you'll be able to see if we've received your ballot or what the status of your ballot is. Please give us about 72 hours from the time that you drop a ballot into a drop box, and maybe even a little bit longer if you drop it off in the post office for that status to be reflected. Now, some people are interested in getting sort of live tracking as the ballot proceeds through the postal system. That service is available through the state. At the website is where'smyballot.ca, where'smyballot.sos.ca.gov. Now, this is a little bit trickier. You have to opt in, you have to register, but it will push information to a voter about the status of their ballot. We want all voters to be confident that we have received their ballot, and that if there are any problems that they're notified and have the opportunity to correct whatever the issue is. So voting early, so there's plenty of time to be notified and to take any corrective actions, is really important. This election, for the first time, we have 37 outdoor 24/7 drop boxes. In March, we had 12, and in 2018, we had 1. So this is a new service that we're providing. We previously had drop boxes inside city clerk's offices, but because of COVID, the offices are closed and not open to the public. So this has turned out to be a good way for voters to return their ballots safely, especially with some of the uncertainty surrounding the politicization of the USPS. I will say, however, that our experience with the post office has been great. The line workers and local folks are very committed to being our partners in the election process, and voters should not have any concerns about returning their ballot through the USPS. However, I will say again, and you'll hear me say this several times, do it early. Don't take any chances. So this is the drop box in Lafayette. It's just outside the Lafayette School District offices. And as of this morning, countywide, or as of today, countywide, 35,000 voters have returned their ballots through these drop boxes, which includes over 12,500, or excuse me, 1,250 in the city of Lafayette. Early voting. This is a service that we started rolling out in 2016. It wasn't terribly popular because most people who wanted to vote early already had requested and voted their vote by mail ballot. but because of the governor's executive order and just the unpredictability of the situation, we expanded early voting sites from the 3 that we had in March to 18 locations countywide for this election. 10 of them are outdoor, again, following health officials' guidelines that anything you do outside is safer. These are large outdoor event tents that we'll have set up that will be fully self-contained with their own power generation, hand washing stations, and porta potties. And the early voting location for the city of Lafayette is Veterans Memorial Building. And actually, our plan is to be in the parking lot in one of these outdoor locations and not inside the building. These sites will be open Friday, October 30th, Halloween, Saturday, the 31st, and then again on Monday, the 2nd of November. But we will also have, for in-person voting, 153 polling places, which is pretty much the same number of polling places in the same locations as we had in the March election and as we had in the 2018 November election. What will be different is there will be PPE required and worn by workers, as well as voters will be required to wear a mask in order to enter. Distancing protocols will be in place, which will automatically lead to what I've been calling the Trader Joe effect. I used to go into the Trader Joe in Lafayette all the time. I used to just walk in the door, grab my groceries, check out, and leave. But since March, every time I go there, I have to stand in line outside. I have to be socially distanced. There's a person at the door making sure I'm wearing the mask and offering me hand sanitizer. That's the same experience that a voter who shows up to vote in person on election day at one of our polling places will have. So if you intend to vote in person on election day, be prepared to stand in line outside. Paper ballots, as always, are going to be available at these locations. One change that will be somewhat visible to voters is we will have an electronic check-in instead of the traditional paper list and roster, which will do many things, speed up the process, we hope, help prevent transmission of the coronavirus. But we expect that almost all provisional ballots will be eliminated because the poll worker will be able to see every voter in the county and will be able to see real time whether or not the voter has already returned their vote by mail ballot. We get a lot of questions nowadays about the reliability and security of voting by mail. So I just want to take a second and give you sort of a sneak peek of what happens to your envelope after you drop it in a mailbox and we pick it up. So first of all, each morning we go to the post office and pick up all trays and trays of ballots in the mail. And actually the truck that you see here is about what we've been picking up each day, represents what we've been picking up each day since last Monday. We also service all the drop boxes on a daily basis, and we gather those ballots. So once we receive the ballots, they come to our facility and they go through a scanning machine like this. This is actually our older version of the scanning machine. This takes a picture of the voter's signature on the envelope and the barcode and presents it to our team of people who verify every signature. This is kind of a mock-up of that process. The signature that we have on file is the upper signature. The lower signature is clipped from the photograph of the envelope as it goes through that machine. This shows a couple of common scenarios where a ballot may be accepted for processing or may have an issue. So to save time without going into any detail, I will just point out that any of these situations that have an X, red X, those voters will be notified that there's an issue or a problem with their ballot, and they will have till November 20th to cure or correct whatever that issue may be. So once the ballots have been signature verified, they go through an opening machine like this. so they can go to the next step, which is to be removed from the envelopes. This is a very manual process, and obviously this is a pre-COVID setting here. We get large number of teams of 2 people to actually extract the ballots, and we load them up with caffeine and coffee, and they just work really hard and extract all those ballots for us. Once the ballots leave the extraction, they come, they go to our tally machines where they are counted. This is actually the machine that counts the ballots. This is a high-speed scanner. We were the first in the country to use this machine. We bought one in 2018, and in preparation for the 2020 election, we've upgraded our fleet to 4 of these guys. So just to give you a kind of a closer picture of what the business end of this thing looks like. So remember, this is what we're going to be doing to 3 million cards on, starting the week before the election until about a week after the election. But we're not done once we scan and report all those results. We have to check our work. We have to audit our results. We have to reconcile, and we have to balance. That takes several weeks, and part of that is to do a manual hand count of a certain percentage of these ballots and to compare it to the machine count to make sure that there are no issues. People always wonder, why does it take so long? Well, it takes so long because we're meticulous in making sure it's correct. It takes so long because voters more and more have been waiting to the last minute to return their vote by mail ballots, which means we have to process them actually after Election Day. So our advice and our message to everyone is to vote early and vote by mail. It's the safest way to vote. It's easier to resolve any issues or questions that a voter may encounter. Any votes, all ballots returned to us and in our possession by the Monday before the election will be included in the election night results. There's a lot of concern about my votes won't be reported till after the election, and actually that decision is in the hands of the voters. If they return it and we get it in our possession, like I said, by Monday before the election, it will be included in the Monday night totals. Our advice is don't wait till Election Day. You never know. If there's one thing I learned in 2020 is you never know what's going to happen tomorrow. There might be fires, there may be power shutdowns, you may be sick, there may be lines. So nothing good comes from waiting till Election Day. So to follow up on the presentation of our public health officials and Supervisor Anderson, our advice to all voters is to be safe, vote at home, and return your ballot early. So we have a pretty robust social media presence. We post snippets every day of what's going on in the election process. Our Facebook is Contra Costa County Elections. We're on Twitter, YouTube, and Nextdoor. So please follow us. Let us know if you have any questions, and I'm more than happy to take any questions right now from council members or the public.
Okay, thank you for the presentation. Are there any questions from council members? Councilmember Burks.
Yeah, thank you. Thank you, Scott. That was a great presentation, and really appreciate what you and your colleagues do for the community. Especially right now with what's going on and the challenges, just absolutely critical. So thank you for that. One question, I got a lot of messages from constituents last Monday, the first Monday after ballots dropped on Saturday, indicating that the ballot boxes in the area were still locked. And this was like Monday mid-morning. Do you know what happened there? And that kind of led to me asking for you to come tonight, and the mayor indulged me with a request.
Sure, yes, I'm very aware of that situation. So the first thing I would say is the legal requirement for us to have those boxes open was Tuesday morning at 8 a.m. We made a decision that we would open them on Monday, thinking that we'd be providing a service to voters to have them open a day early than the required date.
Okay.
And our expected mailing date was actually Monday, but we were able, because we have a very good vendor, a very good mail house we work with, we were able to get the ballots into the mail stream 5 days earlier than what our original plan was. So the plan was to mail the ballots on Monday and open the boxes on Tuesday. So when we decided to mail the ballots on Wednesday and Thursday the previous week, it didn't occur to us to maybe open the box earlier.
Got it.
But we take that as a lesson learned. The only indication to give somebody an expectation that the box would have been open at 8 a.m. was a sticker on the side of the box that said 8 a.m. The date was not, the time and was not published as a hard fast time. And our plan had been to open the boxes throughout the day on Monday. As soon as we realized that it was an issue and that voters were so anxious to vote that they were there at 8 o'clock, we quickly dispatched teams out there, and we had all 37 boxes open by 12:30 that morning. And that was a harbinger of the type of return of ballots that we have been getting and continue to get, and actually expect to get all the way through the election. I have to say, with as difficult as it was for us to plan the logistics of this election, working from home ourselves, and then figuring out a safe way to bring almost 100 workers into a workplace safely to do the election, it's really gratifying and satisfying to us to see voters be so enthusiastic in voting and returning their ballots. I've visited almost every drop box throughout the county over the last week, and there's always somebody there dropping off their ballot. And there's people taking videos and selfies and giving themselves high fives and doing Snoopy dances, I call them, as they drop their ballots off. So I have to say that that is a great payoff for us for all the work we've done to pull this together.
Thank you very much, Scott. And I hope all of you stay safe and healthy, and all the volunteers and all of your staff. So thank you very much.
Thank you very much.
Okay, any other questions from council members? Do we have any public comments or public questions?
Yes, we do. We have Dave Clark has his hand up, and I'll remind folks to use the raise your hand function if you would like to speak. And if you do it now, we can get everyone lined up and get into the meeting quickly. So joining us now is David Clark.
Okay, got it. Thank you, Scott. That's fascinating. A couple of things. There's one comment. When you go to the Veterans Building on those 3 days, they have, I've noticed it's in your picture and in your PowerPoint as well, and I live close to that building. They have a flag drop box on their front porch. It's red, white, and blue, and it looks for all the world like the kind of a place where you might want to drop a ballot.
I saw that this morning when I took the picture.
Yeah. Yeah, and it's there all the time, but it's for flags, not ballots. And I don't know why. Maybe you drape a sheet over it on those 3 days or something. I don't know. But
I tell you what, we have a great relationship with the folks at the Veterans Center. We will contact them and ask them to periodically open it up and see if there's any ballots there. That's a very good point. That thought briefly crossed my mind as I saw it this morning.
Well, actually, I have a question. This has always fascinated me, but the PowerPoints that you showed with the scanning machine working and the pairs of people opening I get from what you said that's happening right now. Is that true?
Parts of that process are happening right now, correct. Yeah. So the initial scan of the ballots to capture the signature and the signature verification and the opening machine that mills the top of the envelope, those are all going on right now. Removing the ballots from the envelope will begin next Wednesday. And the actual tabulation of the ballots through the machine will begin on Tuesday, the 27th. All of these things are open for public observation. We love to have people come and look and watch. It's a little bit trickier right now with all our COVID precautions, but we will do our best to explain and show and demonstrate to voters the process we go through. We're very proud of what we do. We think we're very, very good at what we do, and we love to show off.
Last thing, is that the same county by county throughout the state, the process?
Every county is different. Every county has different equipment, different procedures, different processes, but the steps are all the same.
All right. Thank you.
Thank you, David. Are there any other public comments or questions?
None at this time.
Thank you very much.
Okay.
Thank you
Councilmember
very much
Gehringer
for
has
the
a question.
invitation.
Well, hold on a second, Scott.
Yeah,
Are
not a question, but Scott kind of beat me to it. But after COVID, or however it can be safe, I would encourage everyone to go over and see the operation. It's just kind of amazing, and it's also I would say reassuring. So just in the process that they go through, and Scott is right. Everybody over there is very proud to share what they do. I haven't been for a while. I may have to go again, but thanks for coming, Scott. And I highly encourage folks to go check it out.
Scott, thank you very much. We appreciate your presentation and the work that you're doing.
Thank you very much. Please come down and visit us, especially if you're on the ballot.
Okay. All right. With that, we'll move to our next item, Beth Nadell, upcoming program with Lafayette School District to promote equity and inclusion.
Okay.
There she is, muted.
And Sarah's
I just
joining
finished
now
my
as
ballot.
well.
Oh, very good. You should have handed it to Scott while he was still here.
I learned a little bit about how it's going to be processed. I feel much better now. Thank you.
Okay.
Well, we just wanted to give you an update. So the Lafayette Library and Learning Center Foundation has been pleased to work with both Jennifer and Narup at the city, along with the Lafayette School District, to bring authors and their stories of diversity to students. I'm going to introduce you to Sarah Blumenfeld, who is our program director. But before that, I have a note from Superintendent Whitmore, who wasn't able to attend tonight because he had just this other little function on the other side of town about opening up the schools. So Richard said, the Lafayette School District team has been meeting regularly with the Lafayette Library and Learning Center leadership to find ways to continue our collaboration. We have been especially productive meeting with Beth Needle and Vicki Shaka, who is our senior library manager, before the pandemic changed all our lives. While we live in these unusual times, books are more important than ever. And as our parents know, we have prioritized getting them from our libraries into our students' hands. And the partnership with the library and Marissa Moss with Creston Books is a perfect opportunity to forward a conversation about reading, and especially a conversation about inclusion and belonging. I had a chance to see one of the books, No Steps Behind, which tells a story I never knew about an immigrant woman living in Japan who gave women across the globe a new voice. A book like this gives children new insights into history and the importance of overcoming prejudice in any form. We look forward to deepening our partnership with the library and collaborating on this important project. So he said it better than I do. I'm going to let Sarah give you some information about the authors that are going to be available directly into the schools and through our website. So Sarah? Or Jeffrey to Sarah.
Sarah, if you could unmute, that would be great. Here,
I
let me
think
try
I'm
it.
all ready to go. Can you hear me? Great.
Yes, we can.
Well, thank you for this opportunity. We're really excited about the programs that we've lined up, and I enjoy the chance to share them with people. So this is really fun for me. We have two authors lined up in the next couple weeks, and they're doing two different programs. So initially they'll be doing story time that we've integrated into the Lafayette School District elementary school schedule. They'll both be doing them next Wednesday. Third graders will get to hear from author Nancy Chernin and her book, Beautiful Shades of Brown, which tells the story of a young African-American girl who wanted to be a painter. This is in the 19th century, so you can imagine the challenges she faced. And her portraits of famous singers and politicians and writers now hang in the National Gallery. So it's her story of not seeing anyone that looked like her, who was an artist or who was a painter, and how she stuck with her dreams and ambition and the courage it took for her to become a painter. So that'll be for third graders. And one of the things that we're excited about for that particular book is the author has a program that she incorporates called Paint Your World. And so we've invited children to paint family and friends and people that inspire them, and to bring us their drawings to the library. We'll display them on the glass facing out to the public at the library, and then draw one name to receive a free copy of Nancy's book, Beautiful Shades of Brown. So we've kind of put that out there in our newsletter and through the schools, and the author will talk about it next week. And we're hoping we can kind of engage students in another way as well. The second author is the story that Richard mentioned in his note, and this is No Steps Behind. Beta Sorota Gordon is her name, her battle for women's rights. And this is a story I'd never heard, and most people I tell it to are just amazed. They've never heard it either. Which one of the things I think is so beautiful about these stories is they are great for adults. I mean, all ages are just going to be fascinated. And this was a young woman whose family fled Nazi Germany before World War II and moved to Japan. Her father was a concert pianist. They sent her to Mills College to go to school. World War II broke out and she lost contact with her parents. And after World War II, she got herself a job working with the American military in Japan, translating. And she actually wrote the Japanese Constitution with the commanders in charge and insisted on putting equal rights for women in the Japanese Constitution. And so she had to stand up to these American military because they questioned why they should put this in the Constitution. And she fought for it, and that it's now in the Japanese Constitution thanks to her. So something that women in Japan were able to achieve in the 40s that women in our country haven't yet achieved. So she's, I think, just a really interesting, dynamic person on multiple levels. And so I'm looking forward to hearing that story as well. One of the things we did to kind of round out this program is the Lafayette Library Foundation donated a copy of each of these books to the elementary school libraries. I dropped those off today, so they're available for students to check out and read. And then we've also donated 4 copies of each book to the Lafayette Library so that they're available at the Lafayette Library. And for me personally, I live here. This is my town. I like to be able to support local businesses. So we're collaborating with Belle and Buna, and she's got these books available in her store and also kind of promoting it to her audience as well. So for me personally, I feel like we touch on a lot of different areas, whether it's our businesses, our schools, our library community, our families. And anytime I kind of feel that joint collaboration, I think that's really really nice for Lafayette. So we feel good about that. The other thing I want to mention about Marissa Moss and her books, she's a pretty unique publisher. And one of the things that she does with every single one of the books that she publishes is it comes with a curriculum guide. So teachers can go to her website and download a wonderful resource of materials if they're interested in then taking that story and somehow incorporating it into their classroom. And so I really think that that's a valuable tool, especially now with remote for our teachers. So after these 2 authors do story time next Wednesday, the library has also created programs with them so that we, through the Contra Costa County system, can reach a broader audience. So next Tuesday, Nancy Chernin will do Beautiful Shades of Brown through the Contra Costa County Library, reading that online. And then the following Tuesday, Jeff Gottsfeld, the author of No Steps Behind, will do his book on the 27th as a Lafayette Library program. So not only are we impacting Lafayette, we have the opportunity to take what we're creating here, and thanks to Zoom, expanding it to all the 26 Contra Costa County libraries and really the entire country. You know, if you've got nieces and nephews or grandkids somewhere around the country, they can sign up and tune in and watch one of these programs. So I think that's kind of the highlights for me. I want to thank everybody who met with us and worked on this with us. And are there any questions about the programs that I can answer?
Well, let's find out. Are there any questions from council members?
Good.
Okay, do we have any public comment or questions?
No public comment at this time, Mayor Anderson.
Sign up and join us. They're going to be great stories.
Okay, sounds good. Thank you both so very much.
Yes.
We appreciate it.
Thank you.
I just wanted to also say that wanted to welcome the Lafayette Library and Learning Center Foundation as the GPAC nonprofit member, and Sarah is the alternate from Happy Valley. So we have two GPAC reps here today.
Okay.
We're very excited. Thank you.
Packing the GPAC. All right. Thank you, Beth. Okay, so with that, we'll move to the consent calendar. Do we have any items on the consent calendar that council members would like to remove? Do we have any requests from the public for removal of items from the consent calendar?
I don't, well, no. We have a staff member with their hand up, but I think we know that they'll be coming in next. I don't think that's on the consent calendar.
Okay, so I'm happy to entertain a motion on the consent calendar.
Move the consent calendar.
Do I have a second?
A second.
Take a vote. Councilmember Bliss?
Aye.
Councilmember Burks?
Aye.
Councilmember Geringer?
Aye.
Vice Mayor Kandel?
Aye.
And I'm a yes, so the consent calendar passes unanimously. With that, we'll move to old business. Sarah Allen on the General Plan 2040 update, the GPAC Advisory Committee selection.
And she is joining the meeting now.
There we go. Good evening, Mayor Anderson and members of the council. Just wanted to provide a brief update about the General Plan Advisory Committee results for the General Plan 2040. So just to kind of give a little overview of our applications, we actually had 85 applications, which is excellent. They were fairly well distributed throughout the different regions of the city, as you can see on the map here. And then also on the bottom left, there's a sort of percentage showing each region and how many, what percentage of applicants were from each group. And then just in terms of our outreach efforts, we asked people how they found out about the GPAC application process, and the direct mailings, weekly roundup, and city social media were the top responses. So we will continue to do those things and hope that we get maximum participation in general. So we have our GPAC fully formed. On the right-hand side, you can see all of the members. Staff recruited members from our existing commissions, from Parks, Trails, Recreation, Youth Commission, Senior Services, and Transportation and Circulation Commission. We held the live lottery drawing on last Monday on October 5th. Thank you, Mayor Anderson, for hosting that. And so we were able to obtain our nonprofit member, our one from each region of the city, and then also our at-large member. And so our first meeting for GPAC is scheduled for next Tuesday, the 20th at 6 p.m. We encourage everyone to attend, certainly asking all primary and alternates to attend the meeting. I know we had a public comment about primary and alternates and their role. The primary is definitely the person we're expecting to attend all of the meetings and and work with us throughout the process. And the alternate would be someone that would take over in the event that the person was not able to attend anymore. But really what we're looking for is continuity through this sort of long-term process. And just wanted to, again, plug to the remainder of the public who maybe didn't apply or wasn't chosen, to stay tuned for some additional ways to participate. Visit our website, planlafayette.org or lovelafayette.org. There's a link there too. And that is where we will post all of the information about how to participate and upcoming events. And I'm available for questions if you have any.
Excellent. Thank you very much, Sarah. Are there any questions for Sarah from council members? Okay, do we have any public comments?
No public comment at this time, Mayor Anderson.
Okay. Well, Sarah, thank you very much for the report.
Sorry, let me correct the record. A hand has just popped up, and that hand seems to belong to David Clark. Here he comes into the meeting now.
Okay, thank you.
David, we can't hear you if you're.
David, you're muted. There you go.
Sarah, thank you for the, I appreciate the explanation about the comment that I wrote, but is the idea that if somebody can't go, I don't know, on the third Tuesday of a given month, that the alternate would attend in their place? That, or it was the idea that if someone after 2 years moves away from Lafayette and they cannot fulfill the function because they're not going to be here anymore, that the alternate would step in and complete the term? They seem to be two different things to me, and I wasn't clear if it's both of those, one or the other. I don't particularly care. I just want to understand what it was intended to do.
Certainly. So it's the latter. We will actually go over at the meeting. So this first initial meeting, staff just picked the date and time based on the responses of when people were mostly available. But at that meeting, we will coordinate with the General Plan Advisory Committee to see what the best date and time would be to have to hold meetings going forward. So hopefully everyone will be able to participate.
Okay, thank you.
Okay, thank you, David. Any other public comments?
No comments, Mayor Anderson.
Okay, Councilmember Bliss, what do you have?
Yeah, I just had a brief comment. It wasn't really a question from earlier, but just a comment for Sarah and really to the whole team that had worked on the outreach around the GPAC. I just want to say it was really an impressive job by the group. You know, every part of it, the website, the video, the outreach. I attended one or possibly two of the sort of open workshops you all did. I think, you know, it's particularly challenging at this time when, you know, when you can't actually physically gather people for a workshop and everyone has tons of Zoom meetings to attend. I think to generate turnout at this time is particularly challenging. And I just think the number of upwards of 80 people applying just speaks to the great job that staff did, you know, making the community aware of this opportunity. And I think it gets the GPAC process and the general plan update process off on a really positive note. So I just want to thank Sarah and the rest of the team, Narup and others, for just you know, great work on making the community aware of this process as it gets rolling.
Okay, and while I do think there's a lot of credit to be spread around, but Nancy Tran did a good job. Renata, Jonathan Fox also was engaged, and Sarah, of course, leading the charge. So we do have a really great start on this. The liftoff is spectacular. We need to check in about a year or two from now. Just see how.
Keep that momentum going.
That's right. Got to keep it going. Okay. If there's any other comments from council members? All right, Sarah, thank you for the report.
Thank you.
We look forward to more activity on this. All right, with that, we'll move on to Greg Wolf, and this is on the letter to ABAG on the
Greg
modified option 8A for the RENA count.
Okay, Greg's joining us now, and let me see. I believe there's also Diane.
Correct. Diana Elrod, housing consultant, has been part of the meeting for the last little bit. she just advised her internet dropped and she's going to try to
Okay,
rejoin. But
that explains why I do not see her.
I will just introduce the item. We did not have a written staff report or oral staff report to offer, other than to just introduce the item and say that at the mayor's request, we put this on as an informational item. The Housing Methodology Committee, charged with developing a methodology to allocate the regional housing needs allocation, concluded its many months of work last month and voted to recommend to the executive board using methodology 8A. And prior to that, staff, Diana and I had come to the council and discussed using two different possible baselines that were being discussed. 2019 households, which takes essentially the current condition on the ground and uses that as the baseline, which would essentially perpetuate historic land use patterns and lack of transportation patterns, or using Plan Bay Area 2050 as the draft blueprint as the baseline, which would use the growth and allocation of future jobs and housing near transit and with equity in mind. And so the council endorsed using Plan Bay Area 2050, which is what the Housing Methodology Committee has done. However, at the direction of the committee, staff at ABAG changed from a Plan Bay Area 2050 households, which would be future households, to Plan Bay Area 2050 growth. And in so doing, it reallocated housing units away from job centers and distributed them throughout the broader Bay Area, including all 9 counties. And it had impacts on jurisdictions not unlike Lafayette. It had impacts on Lafayette as well, and unincorporated areas. So, you know, really distributing the numbers to a larger degree. Last week, the Contra Costa Mayor's Conference met and authored a letter, sent it off to ABAG, and we crafted a letter, a cover letter for Mayor Anderson, which he signed, and we submitted that to ABAG MTC. The executive committee will be meeting on Thursday to discuss this. So Diana Elrod is back. And so the letter from the cover letter for Mayor Anderson to ABAG, as well as the Contra Costa Mayor's Conference letter is attached.
I hope.
So we're here to answer any questions you might have.
Okay, Diana, do you have anything you wanted to say? We got you back.
No, thank you, Greg, for doing that. Right now, I'm just like hoping my internet connection holds. So we're good.
Okay. Are there any questions from council members? Okay, Vice Mayor Candell.
So I guess, have you guys seen, you've been through more housing elements obviously than I have. Were you surprised by this, or what? This was a huge shift, right? In terms of numbers, from the prior methodology to this one. I guess, were you guys surprised? What are the reasons why they really chose this method? I know it was the HRAs that all came into this, but is there any other insight you can give to us to understand maybe what they were thinking?
Well, from my standpoint, I feel like the overall allocation to the Bay Area was like 2.5 times more than was last time. So I think that's the big thing that drives all of this right now.
Oh, I understand that the bulk amount,
yeah,
but the redistribution away from the job centers, into the far reaches of our 9 Bay Area counties.
And so
any other thoughts?
To Diana's point, the gross numbers for the entire Bay Area are 2 to 3 times what they were in prior cycles, in part, I think, in response to the housing crisis. And I don't want it to be, it wasn't a wholesale redistribution of housing units that would have gone in the 3 counties that have produced the most jobs in the last 10 years or so out to the periphery. But the difference between using Plan Bay Area 2050 growth and 2050 households is not insignificant. And the most significant reduction is for Santa Clara County, which is the county that has produced by far the most jobs and has the most need for housing, particularly in my mind, in light of our transportation networks not increasing dramatically in capacity, and the state's stated policy goals to reduce greenhouse gases. So with that in mind, we have advocated all along for a jobs housing balance and having housing growth and allocation go to where jobs are. I would say the other big factor that has influenced the methodology is our statutory requirements now that I don't believe were in prior cycles that require the allocation to bear in mind equity and access to high resource areas. And so, there were certainly many voices on the methodology committee advocating for that. And I think to some degree, the Plan Bay Area 2050 did that in and of itself in its projections. But on top using that, but then also the committee included 2 modifiers. Essentially, one was access to high resource areas. So then on top of Plan Bay Area, that was the most significant factor. And then proximity to jobs, either by transit for lower income or vehicles for the higher income levels. So I found it surprising that all 10 of the factors that were developed, so many of them were not included in the final methodology, like natural hazards, be it sea level rise or wildfire, high fire severity hazard zones, et cetera. So with that in mind, we have supported the Contra Costa Mayor's Conference letter, and Mayor Anderson has sent it off as well. And there are other communities that have submitted similar support for using a modified 8A.
Okay, thank you.
Okay, any other questions from council members? Or do we have any public comments?
Yes, we do, and it is Mr. David Clark who's joining the meeting now.
David, you are muted. There you go.
Okay, thanks. Greg and Diana, I'm curious. Maybe no pun. Maybe this train's already left the station. But was there consideration for dramatic changes in transportation in the future, as either due to COVID or as an offshoot of the aftermath of COVID? For example, if BART ridership never gets back to more than 20% of what it used to be, for example, are things like that factored in terms of attaching weight to the transportation element? I mean, if that were true, it would seem to me that would argue for having the housing and jobs closer together. In other words, relying less and less on a transportation piece to connect those two.
Earlier on in this process, the city submitted a letter requesting a delay, pushing off in time, in part because of COVID, and that the region's allocation of 441 plus thousand units did not bear this in mind. It was issued earlier this year. And so HCD has not granted any, nor has the governor granted any relaxation of the timelines required under state law. So we don't have that luxury, or ABAG didn't have that luxury, or didn't feel they did. Neither did they seem to be advocating for that as an entity, but rather kind of going about the business of doing their deliberations and consideration and coming up with what they, I believe, conclude where it was a reasonable methodology that meets all of the statutory requirements. So Diana can speak to it further. She's been attending frequently.
Do you need more?
No. That's good. I appreciate that. Thank you.
Okay. Good.
All right. Thank you, David. Appreciate the questions and comments. Are there any other public comments on this item?
No more public comments at this time, Mayor Anderson.
Okay. Well, with that, we are simply receiving files. So thank you both for the work you've done on this. And we'll continue to track this and see what has to be done to help influence the process, if anything. It may just be a done deal, but we'll see how it works out.
Thank you.
Okay. Thank you both. All right, with that, we'll come to council commission reports, council members' reports on activities and consideration of matters for council members wish to see on a future agenda. And I'll just make a quick note that I have 3 evaluations for the city manager and the city attorney, and it's still the 13th. So there's a real possibility we can make a grand slam here and get them all in. Okay. Now, are there any other comments from council members? Vice Mayor Kando.
Yeah, so Narup invited me to the Rotary meeting and presented on behalf of the Lafayette's Equity and Inclusion Task Force, and got a little PowerPoint together with help from Narup and Jennifer, and it went really well, I think. I don't know if everybody, a lot of people were very positive. I didn't hear any real big dissents in terms, or any really fundamental questions about the task force, or why we were doing it or what we were doing. And so I think people really enjoyed it, and so that was good. I hope to continue to do that for other groups if they are wanting to get an update. So hopefully that will continue.
Very good. That's a good group to have you as a contact. Very good group. Okay, other council members' comments on activities or future agenda items? Councilmember Geringer.
So I was going to say, keep pushing people to do the census. And I will say that, however, there was another court ruling today that put it on another phase of the roller coaster that the census deadline has been on. So the enumerators apparently are slowing down or halting their work for right now. But as of couple of hours ago, the website was still up. So if you have not done your census by this time, I really encourage you to do that. If you know anybody, any of your students, living in apartments who may think that they don't need to do it, please do that. We are, for the most part, in Contra Costa County. Almost every area is over the 2010 self-response rates. There are some areas that in some ways align with the equity, the health zones that were mentioned earlier by Supervisor Anderson, that are still trying to get to their 2010 numbers. So there's still a little bit of time to do that. And so that was that part. And then last night I was looking forward to being on the Lamrend Asserts wildfire Zoom meeting. They had some technical difficulties, and so it was supposed to be 500 people, but I couldn't get on at 100. So anyway, they sent the link, and so on their YouTube site, and I'll send it over. But on YouTube, you can watch that. And so it was talking about evacuation rates, mostly I think the fuel management, fire-wise councils and things like that. And so I do look forward to, watching that and continuing this work to keep pushing us in that direction, which I know it's very important to all of us, particularly with the red flag warning that will begin in the next 24 hours or so. And then I saw that we got the email from Jay Lifson, and I'm excited. The mayor's been speaking to him about vice mayor, 15% cap. And I didn't know if that was going to come back to the next, our next meeting, or.
That would be great. I forgot. Yes.
Research. So anyway, I just wanted to make sure that we had that on our list of things.
Okay, I think the city manager has a comment on that.
Yeah, I have a question. Do you want it brought back for discussion, or do you, before you make a decision?
I think we should list it as an action item.
Yes. So do you want then therefore us to come back with an ordinance or a resolution, whatever format?
I think it would be good to have the ordinance or resolution, depending on how you want to do this, and we can make an action.
Mm-hmm.
Okay, thank you. I'll work with Nyla, and if we can't meet that deadline, we'll get it to you very quickly.
Okay, that sounds great.
And that's it.
Okay, Councilmember Bliss.
Yeah, thank you, Mayor. I actually had a question for Councilmember Geringer on the census report. She just gave. Thank you for that. And also, Teresa, thank you more generally for your leadership in the county around census. I mean, the stakes are enormous for California and for Contra Costa County. So I really appreciate all your work. As I understand it, I think the way you described it as a roller coaster was really apt ever since Secretary Ross kind of went back on the extended timeline, of course, in light of COVID. But just to maybe underscore one piece of that, as I understand it now, this is the last word, right? This is the Supreme Court's ruling on it. And so in other words, I'm trying, is it true that there's a particular urgency for people to be counted, given that I think this exhausts the appeal options at this point? Is that fair to say, or am I getting it wrong?
Yeah, so my understanding was that they just approved the request to halt the actions until a final judgment is held on the Northern California judgment that, now I'm forgetting her name, but anyway, that made it go to October 31st. Yeah. So it's really another sort of halting or impasse. Right. And then as of right now, they still have to rule on whether or not she can push it to the 31st.
Okay, thank you for that.
And the legislature could, extend all of the allocation and apportionment deadlines, but anyway, I'll save my editorial comment.
Thank you. So I guess that's helpful. Thank you, Teresa. And so in light of all this uncertainty, all the more reason for people to get their count done and get it done soon. So,
yeah, so all the messaging is, it doesn't even matter what date it is. If you haven't done it, do it now.
Thank you. Appreciate that.
Okay.
Thanks for the nice words.
Other council members' reports or requests for items on future agenda? All right, we'll move to the city manager's report.
A couple of quick updates. First, about the Equity and Inclusion Task Force. Vice Mayor Candell did a great job at Rotary. And I think she opened many eyes. And it was a good presentation. There's a great slide on the difference between equality, equity, which if it's okay with you, we can post on our website.
I don't own that content.
Okay, we can talk about it.
Yeah.
In one.
It's so good though.
It was a good meeting. I will be providing you with an update on your directions at your last meeting about the items that you wanted implemented which the task force had presented to you. So I'll give you a status update at the next meeting. But I did want to let you know that staff has already started taking the implicit bias training from UC Berkeley. And so we're getting some completed forms already. And as many of you are aware, or all of you are aware now, that Contra Costa may be subject to a PSPS tomorrow. At this point in time, Lafayette does not seem to be affected, but we're watching, and we had a staff meeting to prepare just in the off chance that we may have a PSPS event. So there are many steps that we have taken in the last year to get ready for this event. We are more prepared now than we were last year. We've got more generators to power up signals, to power up a couple of additional buildings. The city offices have gone to a cloud-based system so we can still receive emails. We have more cameras out in the hills watching for potential fires. There's still more to be done, but we're working with our partners to make sure that we're ready and prepared for PSPS.
Excellent. Very good. Okay, any questions for the city manager? Okay, then we will move to written communications. And we have a request for a proclamation recognizing Wednesday, November 4th as Shelter-in-Place Education Day in Lafayette. Do I have any interest in a motion on that item? Vice Mayor Kandel?
I make a motion that we approve the proclamation recognizing Wednesday, November 4th, 2020 as Shelter-in-Place Education Day in Lafayette.
Excellent. Do I have a second?
Second.
Okay. Then any discussion? We'll call the question. Vice Mayor Kandel?
Aye.
Councilmember Geringer?
Aye.
Councilmember Burks?
Aye.
Councilmember Bliss?
Aye.
And I'm a yes, so it's unanimous, and we will have a proclamation in place for November 4th, 2020 as Shelter-in-Place Education Day in Lafayette. Our next item, 15B, is a request from Lynn Cass proclaiming
And Mayor
October...
Anderson, Anderson, I believe we have Lynn Cass here to speak on it.
Oh, okay, well, I was going to announce it first, and then
Okay.
I knew there would be at least one public comment, so why don't we bring Ms. Cass in?
I believe this is her now, although it says Michael. Ah.
Hello,
Hi.
welcome.
It does say Michael, but I'm obviously not Michael. First, I want to thank all of you for adopting the proclamation that I proposed last month for Hispanic Heritage Month. I'm very appreciative of that. And today I bring forth another request for Disability Employment Awareness Month, which is this month. And again, a lot of this stems from my interest in watching what the task force is doing towards equality within our city. And I'm really appreciative that you're attempting and not only attempting, but making some progress towards this end. This year marks the 75th anniversary of Disability Employment Awareness Month. And it's also the 30th anniversary of the passage of the ADA Act. And so I thought it was really appropriate because of those two historic events that we take the opportunity to acknowledge them within our city and to really put forth even more of an effort towards equity in employment, and also making certain that the ADA Act is acknowledged, and that our businesses and the city make sure that we are welcoming to people with disabilities.
Okay, thank you very much. Are there any questions for Ms. Cass? All right. Do we have any other public comments on this item?
No public comments.
Okay, so bring the item back to the council. We have a request for a proclamation recognizing October 2020 as Disability Employment Awareness Month in Lafayette. Do I have a motion?
So it says discuss and direct, but I'm happy to make a motion that we recognize October 2020 as Disability Employment Awareness Month in Lafayette.
Okay. I think the difference here is that we don't have the proclamation written yet. So we're gonna, Joanne's gonna put it, she put it, oh, she's done it.
It's
You
here.
got it.
Yeah.
You've got
Okay.
I thought it
All
was.
right.
There you go. Okay.
So do I have a second?
So moved.
I'll second.
Okay, Councilmember Bliss, second. All right. Any discussion? I'll call the question. Vice Mayor Kandel,
Aye.
Councilmember Geringer,
Aye.
Councilmember Burks,
Aye.
Councilmember Bliss,
Aye.
and I'm a yes. It's unanimous, and we will get that proclamation out. Okay. With that, we have completed our open session agenda. We will now adjourn back into closed session, and we'll report out after that closed session is over. So into closed session now, and the open session meeting will remain open until report out from our closed session. Thank you. See you in closed session.
Before we start, just give me a heads up when everybody's in. Well, I'm here, but when I won't start the recording until everyone's in.
I just came back for fun, Joanne. Oh, Mike wants in.
No, the thing is, when everyone comes in, they start moving up and down the line, so it's hard to catch them all.
Okay. All right, we are back from our closed session and we have no reportable action from our closed session. And so with that, we are adjourned. Thank you all very much.
Good night.
Bye. Good night.
Good night, everybody. Take care.